I'm Edwin Suarez with Suarez Physical Therapy. Our facilities treat adults and children with sports, auto, and home injuries, as well as post-surgical trauma. Our care experience certified clinicians provide manual therapy, dry needling and cupping, along with spinal traction decompression, low-level lasers, and acoustic shockwave therapy. We accept most major insurance companies and attorney liens. We're open 7 days a week and have convenient locations across the valley. Please give us a call or visit us at SuarezPT.com for more information. Suarez Physical Therapy. Care. Experience. Certified.
Passionate, consistent, and confident care from the moment you walk through the door. The gentleman you're about to meet offers treatments for a wide range of injuries and people, from pediatrics to seniors. Edwin Suarez is the owner of Suarez Physical Therapy. He is back in the studio this morning to talk a little bit more about it. Good morning. Good to have you.
Likewise. Thank you very much for having me. I appreciate it. Primary patient caseload is orthopedics, so we see a lot of patients that come in for, work-related trauma, motor vehicle accidents, post-surgical patients, orthopedic cases, and then a small, portion of our practice is dedicated to seeing children as well with varying neurological diagnoses.
Oh.
Majority of our adult patients, orthopedic patients, come in for back pain, and so we see a lot of,
Sure.
back pain from repetitive type of injuries. A lot of our housekeepers and or teamsters type of patients that work in construction. And so I think from the orthopedic basis, our primary referral is probably back pain. And so we patients with discogenic lesions, herniated bulging discs, and things of that nature. So care experience, that's our philosophy, as you mentioned before, compassionate, consistent care.
Yeah.
At our 4 facilities. What that means is no matter where they go, which location they go, they're going to receive the same trademark, service. We spend a lot of time training our clinicians before, and they're on their own with our population of patients. And so we have patients that come in throughout the years for varying diagnoses. 1 year maybe shoulder or maybe post-surgical knee, and we pride ourselves on that. And also keeping a low patient-to-clinician ratio, so we try to keep that very low so that they're getting as close to individualized care as possible, that one-on-one care. So it's individualized care, as I mentioned previously. What that means is you'll get examined and we'll develop a treatment plan that's specific for you as a person and your diagnosis. So none of our treatment plans are cookie cutter type treatment plans because everyone is different. Every back pain injury is different. Website, SuarezPT.com. There's a list of our contracted insurance list. And then we do medical liens for our patients that are represented by attorneys after a motor vehicle accident. We can see them as well. But we offer amazing, manual techniques, therapeutic exercise, functional dry needling, acoustic shockwave therapy, so on and so forth, cold lasers. And so we're very progressive, and a lot of that information and you can find on our website as well. That'll give you an explanation about each one of our treatment modalities and our manual techniques that we offer at all 4 of our locations. We have 4 locations, northeast, northwest, southeast, southwest. All of our 4 locations are conveniently next to a major interstate or highway, if you will, freeway. And so very easy access to get to all 4 of our locations.
The phone number or visit the website
Directly.
on your screen. Edwin,
Very
such
nice
a pleasure
to
to
meet you.
have
Pleasure.
you.
Thank you for having me again.
I'm going to have to talk to you a little bit more about
Come
some of
see
those
me.
treatment methods.
We'll throw some
Very
needles in
interesting.
you real quick.
Hey, I love it. I'm game. They're also on Facebook and Instagram, folks, if you are interested. Suarez Physical Therapy.
trigger point there. And what I'm going to do is I'm going to take my needle. I'm going to do a quick insertion of that needle. All right, you may see a little bit of a contraction as I push the needle through. I might piston it a little bit up and down and try to see if I can get that muscle to contract. No contractions there. But once it's in there, I'm going to add a little bit of electric stimulation to that needle, driving it. Dry needling almost pushes the reset button on that muscle to get those cross filaments and cross bridges to start contracting efficiently. You know, is that pretty good, or you want me to go up a little bit more?
You can go up a little more.
So as I go up, we kind of recruit more muscle fibers, and so as I go up, you're going to start to see a little bit of a shrugging of the shoulder. Well, you know, for the insertion of the trapezius around that shoulder blade area. And again, trying to create like that lymphatic drainage so that we can decrease some of that inflammation and pain that she's experiencing. I'm just going to grab that ASIS and then I'm just going to pull it over until she tells me she feels a good stretch on that lateral hip. Where do you feel that stretch? Do you feel it back there on the side? So that stretch is going to feel closer to the hip area.